Hello, hey everyone, welcome to Sleepy Radiology classes. And I promise it will be easy for you. Hello everyone, welcome to our Sleepy Radiology classes. And myself Savvy here. Today we are going to discuss on the topic angiographic kit, and it is a very important topic. You will be knowing here what we use in angiography, what are the kits required, and how you will make the tray arrangement. So before going to the making the tray arrangement, you have to see that the tray consists of all the sterile equipments, and don't open it with the naked hands. Always wear gloves and open your angiography kit, and that will be opened by the scrubbing nurse and the team, not by you. So you can see here, this is the sterile equipment, or we can say sterile gowns, and always this will be worn by the surgeon who will perform the angiography and the scrubbing nurse team. And always keep in mind that this will be only used or opened after performing the hand rub technique given by WHO, and they have to maintain a fully sterile condition, otherwise the patient will be getting infected. So these are the sterile equipments. So first thing is you have to wear the PVP gown, that is will be a close wrap gown. Next you will wear the hand gloves. After you wear the hand gloves, you will wear the mask and you will wear the head cap, and you will be ready for the PEP. And after that, confirm that you will not touch any unsterile things. So this is how we will arrange the trolley, and we will keep the equipments in order, but you have to keep in mind you have to wear the sterile gloves. And these are the equipments we require for our procedure. So prior to the procedure, make sure from the ward itself that the patient area of puncture is cleaned, and there should not be any small amount of pubic hair too. Next thing is this is the betadine. This is we are using also gauze piece, and with the help of betadine and gauze piece, with the help of arterial forceps, we will clean the area in anti-clock and clockwise direction to make this area disinfectant. Next, these are the kidney trays where we will discard all the cotton balls and the gauze pieces, and these are the various sizes of our kidney tray. Now after cleaning the area, you have to palpate the area and look for the femoral artery or the site of puncture and that arterial area. Next thing is you have to confirm whether you are going for percutaneous process, so this is the percutaneous, or the incision process. So if you are using percutaneous, you have to require the needle, and if you are using incision, you have to require the surgical blade, and these are the various types of surgical blade. So the area of puncture is called as the puncture site or catheterization site, and basically we are going to use the femoral artery, radial artery, carotid artery. But once you are doing the puncture, you have to confirm it with the help of ultrasound guidance or the fluoroscopy guidance, so that it won't puncture the other part of the area. As I have said, we have two methods, one is percutaneous and another one is incision. So now we will see the percutaneous process. For this process you require the Saldinger needle or lumbar puncture needle of sizes 16 to 18 gauge. Next is you have to apply general anesthesia to the area, or you can apply local anesthesia. Then at 45 degree you have to puncture the site, and once you are puncturing, you have to confirm that the needle won't cross the posterior wall of the artery. It should be in between, and this all things you have to confirm under fluoroscopic guidance. So this percutaneous technique you can apply for non-selective angiographies, where we no need to change the catheter much, but in case of selective angiography we have to change the catheter then and then. So the best method is our incision technique. So this is the incision technique. You have to mark the site. Next thing is, before doing any of these procedures, protection of the privacy is very much important, so that is why we are going to cover the rest of the part with sterile towel, and only the area of puncture will be kept open. So for this technique you have to require the sterile blade of 11 size. Remember that the sterile blade should be open then and then, not before the procedure. Next you have to apply general anesthesia to the site, and for this technique you have to use this device, and this is known as arterial sheath. An arterial sheath allows you multiple exchange of catheter. So like this we will puncture the area, we will look for the free flow of blood. Next thing is we will insert the arterial sheath, and you can see it in the image, and the main purpose is it also protects the arterial vascular structure from any kind of rupture. So this is the first step of our Saldinger technique. Puncture the area, look for the free flow of blood. Once it is confirmed, remove the stellate, and we will see the next step. So our next step is insert the guide wire, and the guide wire is used to guide the catheter. Next we have to inject over the guide wire, we have to inject the catheter, so via which we will inject all the contrast media, and once the catheter is inside we will remove the guide wire. So you can see these are the images of guide wire. Always the guide wire comes in a coil form, and it is of two types, straight and J shape, and you have to slowly introduce it, and it is in the length of 120 to 180 centimeter, 0.038 inch, and they are introduced slowly, but remember that full portion of the guide wire should not be kept inside the body, it should be kept little bit outside. Next, after guide wire, these are the catheters. So we have various sizes of catheters are used based on various structures, and it is measured in French, and you can see here various types of catheters. The main purpose of catheter is to inject the contrast media for our procedure, and they are made up of plastic or Teflon. When you are selecting the catheter, it should be based on the type of the artery present. So every individual artery has different shapes, that is why accordingly we have to use the various types of catheter. So see here during the procedure how we insert the guide wire. Black one is the guide wire and white one is the catheter. So guide wire is our railway track who tracks the blood vessel whether there is any clot, abscess or not, and catheter is then introduced to inject the contrast. So this is the contrast. Here we are going to use basically the low or smaller contrast like Omnipack, as they have less chances of contrast reaction, and this is safe for the arteries too. And when we are using selective or cath lab angiography, we can use the normal syringes of 50 ml, and if we are using for non-selective or CT guided or MR guided angiography, we can use the pressure injector. It is also used in cath lab for 3D rotational angiography, where we have to inject bulk amount of contrast in short time. So that are all about the equipments we require for angiographic procedure, and I hope now it is very easy for you to arrange all the equipments before the procedure. And we should always use the sterile technique regarding this procedure. Next we are going to discuss some accessory equipments which we require for another procedure, that is angioplasty, which is just done after the angiographic procedure to repair the damaged arteries or blood vessels. So for these things we have to require such small additional equipments, so which are now we can see here. So we can see this angioplasty procedure are both diagnostic as well as therapeutic procedure. So first we require is a balloon catheter, and this balloon catheter will inflate the areas where there are stenosis. Next, after the inflation, so that the stenosis won't come to its original shape again, we are going to use the stent, and these are the stents we use in angioplasty, and they are made up of stainless steel. So balloon and stent we are going to use for only the areas where there is stenosis, that is narrowing. But if you have such kind of area where there is dilation, which we call it as aneurysm, so we have to use another type of equipment that is known as embolizing agent, and they comes in a liquid form, gel form, particles or coil form. So you can see here they are in coil form, liquid, gel and foam, and this we will put on the arteries and we will block that area and we will prevent the free flow of blood. So here is a short video where we can see how we do the stenting as well as we do the embolization with the help of embolizing agents in the blood vessel to prevent the narrowing as well as to prevent the dilation of the arteries. And the main purpose to block the dilation or the bulge areas is to prevent the unwanted flow to that area. So once you put the gel or any embolizing agent, that will block the area and will prevent the blood to reach that area. Only you will have the normal flow passage. You can see here clearly how we are blocking the bulge area, and this will prevent. Next we are having this called as a jumper, by which we can jump this, and this is the device. It just works like a spring pan. So once you press the spring at a very high speed, that coil will go and get attached to that area. And if you are using the particles or molecules, you have to centrifuge them at 3000 rotation per minute. Then you have to make them liquid and you have to put in the syringe, and then we have to inject them. So well, that was all about our session of angiographic kits and the angiographic tool arrangement. So I hope now it is very much easy for you what were the equipments we require for angiography and what we require for angiography procedure and for also our angioplastic procedure. And if you have liked the session, please do like, subscribe and share it to all the persons. Thank you so much.